For more than 20 years, the Medicare Rights Center's staff and its volunteers have been a solid and resounding voice for older and disabled Americans on Medicare. Our voice has been heard by millions of people through our national consumer helpline, through our educational materials, and through our policy work in Washington, D.C. and Albany. It has been with this voice that we have educated and empowered millions of Medicare beneficiaries, their caregivers, and those professionals who help them get access to quality and affordable health care.
Every day, we hear stories from people who are having trouble getting the health care they need and are entitled to. And in many cases, even if they have health care, many people simply can't afford to pay for it. It is these stories that help us target our counseling messages, focus our educational materials, and develop our policy initiatives. It is through our dedicated and enthusiastic staff and volunteers that we're able to provide one-on-one assistance on our helpline. And it's through our educational materials that we can help thousands of others understand the ins and outs of their Medicare benefits. Last year, for example, our staff and volunteers right here fielded nearly 13,000 questions. Of that number, nearly 5,000 of those calls were from people asking for help to appeal their denial of coverage. Oftentimes, those calls require in-depth research and even legal counsel to fight those battles. And the helpline also provided detailed information to more than 2,000 doctors, lawyers, and social workers who, in turn, reach out to serve countless others with Medicare issues.
Mary Singleton contacted the Medicare Rights Center about a Part B premium penalty she was being charged. She was told she should have signed up for Part B 8 years ago, and because she didn't, she'd now have to pay a penalty of an extra $80 a month, and she just really couldn't afford that.
I asked her, could she assist me with an issue I was having with Medicare, where I was going to be penalized $80 per month for the rest of my life. So therefore, and she in turn referred me to the Medicare Rights Center. And I gave them a call, and they assigned me to a caseworker that opened up the door for me, was very diligent, professional. Every time I called, they never got tired, they were relentless, they just followed up. If they didn't understand what was going on, they went to another co-worker, and they had this cohesiveness, and they worked together until they resolved my issue, which was giving me my money back.
Ivan Balchev, a recent retiree, found himself in the hospital immediately after retiring and accumulated bills for his heart surgery to the tune of $150,000. Because of the timing, he didn't have a chance to enroll in Medicare Part B. Mr. Balchev's case had a lot of moving parts, but in the end, we were able to fix a billing issue which took care of a large portion of his hospital bill. In addition, we were able to work with Social Security to have him retroactively enrolled in Medicare Part B to take care of the remaining portion of his bills.
My local councilwoman referred me to the Medicare Rights Center, and the help I received was practically magic. After a little bit of initial communications, in the stretch of about 2-3 months, I got all my bills, medical bills, heart surgery bills, paid by Medicare and by Social Security.
For more than 2 decades, our helpline has been at the very heart of the Medicare Rights Center. Each of our callers receives one-on-one counseling from our staff of trained volunteers.
By answering questions on the National Helpline, the Medicare Rights Center is able to develop educational materials to assist thousands of older people with similar questions. Our education team maintains a variety of resources, from newsletters circulated to thousands of people, informational flyers, and online resources such as Medicare Interactive and Medicare Rights University. Medicare Interactive is our online resource, containing up-to-date answers to thousands of Medicare questions. In an effort to reach over 500,000 people with up-to-date information, we partner with corporations, nonprofits, and unions to promote Medicare Interactive so they can help their retirees or members save money on their medical treatments, drugs, or appeal a denial of coverage. And we also launched a new site last year, Medicare Rights University. This site shares the very latest information with healthcare professionals from around the country. Through this online subscription service, Social workers, elder law attorneys, and other professionals can keep abreast of Medicare changes.
You've just heard about Medicare Rights Helpline. Now I want to tell you about our grassroots community outreach program called Seniors Out Speaking. This educational program was launched in 2001 by a group of trained senior volunteers who went out into the Westchester community in New York, armed with the latest information about Medicare. Since that time, the group of senior volunteers has grown to more than 200 strong and covers more than 7 states. Seniors Out Speaking volunteers hold monthly educational meetings called the Medicare Minute, where a Medicare topic is presented and discussed. The main goal is to educate seniors to understand their health coverage so they can get the best health care available.
On another front, our Medicare Rights team actively pursues policy reform in Washington, D.C., in Albany, New York, as well as other state capitals. We are trying to make it easier for people with Medicare to get the health care they need. And we're continuing to gather information from our thousands of helpline callers to identify trends and concerns, and then zero in on those Medicare areas that desperately need to be improved. While we help thousands of people save millions of dollars, there are still countless others who are eligible for low-income programs but are not enrolled. We're determined to continue advocating for common-sense solutions and make it easier for those individuals to find and enroll in these programs. We are also proud to be leading a statewide coalition of organizations representing older and disabled consumers. The goal of this newly formed team is to work with our state and federal governments to implement a new care delivery system for the most vulnerable people in our state, those people who are both eligible for Medicare and Medicaid.
As you've just heard and seen, the Medicare Rights Center remains energized and determined to have a big voice in the Medicare debate. And as long as half the people on Medicare have annual incomes of less than $22,000 and spend 15% of that money on health care costs, we will continue to push for Medicare reform. As long as millions of people eligible for low-income health care programs aren't enrolled, we will continue to develop programs to reach out to them. And we will continue to remind everyone who will listen that the Medicare debate is not about money or deficits or revenues, but about real people, our families, and our neighbors.